Hi there, everyone, and welcome to the Athlete Cafe.
Hi guys, I'm Carly, former collegiate lacrosse player.
I'm Abby, former gymnast and collegiate dancer.
I'm Frances, former collegiate track athlete.
And I'm Emily, former collegiate volleyball player. Let's get into today's topics and see what's on the menu.
Large cappuccino. Orders up.
All right, welcome back to the Athlete Cafe. How was everybody?
Ooh, pretty good.
We're good.
I got
Friday.
my dog.
Yeah, the therapy dog.
Not my
over
dog,
there.
but
He always goes to you, I feel like, no matter
Yeah.
where you're sitting.
we're
Yeah.
besties.
Let's have that like energy around you.
What can I say?
Look at him.
Oh, thank you.
He's so cute.
Yeah. We're besties. Yeah, I know.
How cute.
Okay.
All right, so we kind of want to get into it today. I'm just going to combine that.
Combine that.
Yeah.
I hate when I do that.
And give a little bit of a education, explanation, understanding to the best of our ability, because it gets
So gray.
kind of confusing and gray, of just the differences between mental health and counseling and clinical counseling versus mental performance coaching and having more of just that coaching role.
Yeah.
I feel like that's
Yeah.
everyone's big question, and I think all of our athletes that come to our sessions, like, what are we doing in here, or like, what is this going to be? And there's 6 of us here at Sharpen Skills Training, and we all have somewhat different backgrounds, very varied in the work we do, but we all basically do the same thing. So it's really confusing but cool at the same time, and hopefully this is something, like, if you've ever wondered, like, what the heck is the difference,
And what you need, right?
if I need to see somebody, like, what's going to best fit me and my needs. And also, if you're interested in this profession, hopefully this will help you kind of potentially narrow down your path based
Yes,
on what
hopefully.
you want to do.
Yeah, I feel like the lines get a little blurry, so
For sure. And I think to me, there's a lot of power in the fact that there's overlap, because it opens a lot of doors. It's not like you have to have a clinical issue in order to go see somebody. Like, if you're still struggling with more of a coaching type situation, which again we'll explain, there are people out there for that. And it just being able to research the right person and find the right fit for you. And honestly, sometimes it's all about just finding the right
the right
person
to
sit
click
and
with,
talk with
yeah.
and click. And by all means, if you are with someone right now and you're like, this is just not it, even though you're getting good information, or you feel like they're trying to work with whatever you're going through, like, that's okay. Go find somebody else.
Yeah. It's like it's a relationship, right?
Yeah.
Like you have to feel good about that person when working with them, and it's a two-way street, right? It doesn't, no matter their background, it doesn't matter if they have the top of the line background or a doctorate, whatever. It's you have to be able to click with that person and feel comfortable to talk about the things you're going through.
For sure. So I think the one big disclaimer that I do want to give, though, is, like, any information we give today, like, please do not diagnose yourself. Please do not.
This isn't TikTok.
This is not TikTok. Like, yes, we are professionals, but, like, we don't know who you are if you're listening to this. So we are giving general things based on what we've seen, or, like, general professionals that could alleviate and help with certain just issues people might be having. But don't walk away from this and be like, oh my gosh, I definitely have anxiety. Like,
right.
maybe you do, maybe you don't. I don't know, but go talk to somebody.
Yeah.
Don't just
Bottom
listen.
line, go get assessed yourself.
Go get assessed. So just want to get that out of the way first. But I think the biggest piece that we want to start off with is this idea of, like, what is the difference between mental health and counseling versus mental performance coaching? So I guess, do you guys want to? Do you want to have me go through it, or?
Yeah, I mean, I think, like, in my brain, I just think of, we have a graphic that we kind of look at more, and it's a helpful graphic to show kind of what provider would be best for what you're kind of going through. And the simplest answer is kind of like, if you have, let's say, anxiety, right? For example, if that is affecting your day-to-day life outside of sports, it's ongoing for months, weeks, days at a time, that's going to be a more clinical problem, I would say, right? A more mental health problem. Now, if you have some performance anxiety in sports, you maybe just get anxious or have those pregame jitters before you have a competition or a game, I would say that's more of the mental performance coaching side, right? So it's kind of looking at duration for sure of what you've been experiencing and if it's affecting your day-to-day life outside of sports. That's kind of how I view it, but
Right.
Yep, I think that's perfect. And that's, again, just being able to know, too, disclaimer, like, there are times in our lives, everybody experiences some level of anxiety or stress. Everybody feels sadness. Everybody feels like kind of higher level sadness that some may call depression. And some of that, it just goes back to, like, how long is this persisting for? Is it going into different areas of life? And I was thinking on the way here, like, I remember back in school, like, I would be so high stressed when I would have a week where I had, in high school, 2 games that week where we were traveling, and I had 5 tests and a paper due. I felt like I was literally going to explode. Like, I didn't know how to control my emotions. I didn't know how to, like, manage my stress levels, and it was horrible. But the next week when it was all over and I was in a new situation, I was
Back
fine.
to normal.
I was
Yeah.
back to normal. So it's okay to experience some of those really high stress, high anxiety moments. And, like, again, yes, talking to probably in that situation more of a coach can help you, a mental performance coach can help you manage, okay, how do I manage those really high pre-game jitters or anxiety, or even if it's for a test, like pre-test anxiety is definitely a thing.
Yeah.
How do you find control in that? How do you put forth your routines to be able to study well or to prep well and practice that week? Like, those are all things that are really good for a mental performance coach to be working with you on. But again, that stuff is normal.
very normal.
It's going to
It's
happen.
going to happen for sure.
Life is crazy, which makes life fun and exciting, the ups and downs. But again, if that stuff is persisting for a long period of time and just doesn't go away, that's when you need to go see more of a clinical counselor, because, again, they have that background. So hopefully that answers the question a little bit. I know that's a pretty quick
response.
but mental performance coaching versus more mental health counseling.
And I would say maybe like some topics, right? So clinical mental health would be anxiety, depression, OCD, ADHD, PTSD,
Spectrum disorders,
spectrums,
eating disorders.
eating for sure. That's definitely clinical. That's going to be your mental health therapists, counselors, psychologists, psychiatrists. Am I forgetting anything?
There's also school therapists and
School counselors,
school
yeah.
counselors and school psychologists as well.
Definitely, yeah. Like if you're at college, anyone on campus for you, that definitely would
Counseling
be helpful.
center.
Counseling center. Now, pregame jitters, right? Performance anxiety, confidence, expectations, routines, pressure, stress,
Goal setting.
goal setting, time management. The general things, right? Things that you're probably going to experience at some point in your sport career. That's going to be mental performance coach, or could be clinical too. That's why it's gray area, because they definitely overlap in many ways.
Yeah.
And I think I like that you went through those topics and kind of distinguished between the two. And again, like, you may think that you're feeling heavy anxiety. Go see a clinical counselor, and they'll be like, okay, you have this, and this. Yeah, maybe we should look into this more, or like, hey, this isn't as severe as you need. Maybe go see a mental performance coach and kind of help have that distinguishment a little bit. But I think another big question that most people have is like, what is the difference between a therapist and a counselor and a psychologist and a psychiatrist and all this stuff?
We are like, no one is educated on that. Like,
It's a
Nobody
good
knows.
question.
That's a great question, right?
And I think the biggest piece is that it's so different state to state, which is
Yeah,
what makes
true.
it confusing.
Yeah.
Yes, because this information would be pretty much just in Ohio. Like,
Correct.
my knowledge is Ohio based. I think
Correct.
it's a little different.
So I think, like, because I've done some presentations on this and I've researched some of it, but I think just to give a simple breakdown of it as like, Carly and I have master's degrees in counseling. So we went through a clinical counseling program. We took specific classes that gave us that background. We had internship experience where we used our clinical skills, and we did that. Francis, how is yours a little different as a psychology?
Yeah, so my master's degree was in clinical psychology, and clinical and counseling, like, the lines are pretty blurred just in general, but I think my education background was more like research based and rather than like practice based, because like with counseling you get more of that experience of like actually meeting with clients and like getting like some type of like face-to-face interaction, but like my clinical experience was more like researching what you would do in like a therapy setting or like a counseling setting without actually like doing it. Yeah.
And that's how I honestly explain it to a lot of people of like, again, depending on your state, I'm talking specifically from the Ohio perspective, but counselors, therapists, same thing.
Synopsis. Yep.
Same thing. Really, degrees are probably very similar depending on the state you're in, but if that's what you're looking for, those people are going to sit with you in session. You're going to meet weekly. You're going to get interventions from them. You are going to talk to those people. The counselors, therapists are the people who do like that grunt work with you. A psychology or psychologist, I say more or less, is, again, I think it depends on whether it's more of a doctorate or more of a master's level, but a master's level psychologist does more of the testing, more of the research.
Yep.
They are not in the nitty gritty with clients. They are creating the tools. They may administer the testing tools, but they don't do the therapy.
No. Yeah.
So I think that's the biggest difference. In like within a school system, you can have school counselors and school psychologists. The school counselors meet with the kids and talk with you, but the school psychologists do more testing.
Yes. Yeah, they do all the background
assessing the background, all of that stuff. So if you like research and you like
I do not. Writing
and
papers.
research.
Same. I don't either.
A good choice then over there.
Go for the psychology route, but if you want to be in it with the people and kind of be more, build those relationships differently, go more towards the counseling therapy route.
Yeah, and that was something like in my journey, I thought that I wanted more of that background experience where I can do the background testing, the research, because more on the introverted side, like the idea of sitting down one-on-one with someone was more scary as I was like coming out of college. So I was like, yeah, clinical psychology, like more research side is where I wanted to be. But I mean, through that experience, you learn, you grow, and I realized that maybe that wasn't the right path for me. But as we said in the beginning too, like all of our backgrounds are different, but like we all ended up at the same place. So like there's no one right way to get where you want to be.
And, you know, you can't blame yourself because it's not like from my experience, I had no help figuring out what the next step after my undergraduate degree was. It was, hey, I know I want to help people. I think I really like therapy, or I think mental health is sweet. Like, what do I do next? And no one had an answer for me.
Yeah.
So to be honest, like you don't get a lot of education on that when you aren't looking for this field. That's why I think this podcast is so important, just to give a little bit of insight. And I always tell people like network, talk to people.
Yeah.
Everyone probably has a different background. Like I feel like no one has a straightforward,
Yeah.
like I knew I wanted to be a doctor or a lawyer, so I have like this undergraduate degree and then I know I have to do this. Like that is just not this field as of right now. Could change in the future.
Yeah.
But for Frances's point, like just because it's gray and maybe you made, you know, not a wrong decision by any means, but maybe looking back, you're like, maybe that wasn't what I wanted, but you still got to where you are. You know what I mean? It's still possible.
Yes.
Yeah. So.
Yeah, I was scared when I was in my internship. I had no idea how to talk to people. I was like, what do I do? That was like the one thing. I was like, how do I sit in a session? What do I do? They like did not teach you that.
Well, I feel like that's the whole memes with therapy is like when you're in your master's program, if your first internship, it's like, okay, bye, we'll see you later. Like just figure it out by yourself. And you're like, wait, you're leaving me in a room alone with this person? Like I have no idea what to do.
And it's also like really hard because like you can't be told what to say in those situations because it just depends on who your client is and what conversations get brought up, and you can't like ever really plan for that.
No.
So
I always say this probably is bad, but like I really don't know if I learned anything in my master's program. I learned everything in just doing. You cannot teach it because I mean you obviously teach
the theories and the interventions and how to use it.
But I'm like, okay, that's great. I use this motivational interviewing thing. Okay. And then I'm like, what is that? How does that actually look when I'm talking to someone? And then along the way, you figure it out.
Yeah.
So.
Yes. Practical application is always the best. So I think obviously going back to just the different roles, but I think counselors, therapists, psychologists are probably the most commonly seen. And I think at the higher level, so then you get more towards a doctorate. Like we all have our master's degrees. And again, disclaimer as well, if you're working with somebody who does not have a master's degree, please rethink what you're doing.
Yes.
I'm making
Yes.
eye contact with you right now. Please get somebody with education.
Yes.
Yes.
Okay. I'm not
Yeah,
going to at anyone out here, but make sure you do your background checks.
Yeah.
Anyway, so going more towards if you choose to go for a doctorate degree, that's great. Obviously, a lot more schooling. I knew I did not want to do that. But
Same.
at the time when I was like looking and thinking about working with athletes, like that was really the only route was to go get your doctorate in sports psychology.
Yeah.
And I'm like, ooh, I just don't want to do that, I don't think. And again, from my understanding, a doctorate is more of like the teaching, the research, all of that. And I do think a lot of doctorate sports psychologists, they work with the high level teams. They work at the universities. They work with the pro teams if they have enough experience. I do think, and again, psychologist versus counselor, like it just depends on your background. And sometimes it's all about who you know, not what you know. But I think when you see the professional or like the high level college sports, like they have their sports psychologists on staff, and those people do have doctorate degrees. And if that's a lifestyle that you ultimately want to get to, that's great. I always say like start with a master's degree and then kind of work your way up. But it is more schooling and it is more like research based. And I think just the way that, you know, I don't exactly know what the actual client or athlete to athlete work is like. You know, I think it just depends on the job that you have. So it's another route, and some people love school and want to do that, and that's great.
Yeah.
And then the top tier one is obviously psychiatry. So
Yeah.
And the difference there.
Psychology
That
and
is-
psychiatry are
Yes.
different.
Why couldn't they have
very
made them
different.
different words?
Different word, like very different. Not
You know, just
Yeah.
a few letters off.
psychiatry is med school. If you want to become a doctor, you are going to be, I mean, if you get your doctorate, you will be also
I was
a
going to say,
doctor.
that's the other confusing part. It's like you still are a doctor with a PhD or a PsyD.
Correct.
if you want to
And
be
then
like a medical
Medical
That's
doctor.
medical
You
doctor.
prescribe medicine.
right.
Psychiatrists are the only ones that can prescribe medicine. A counselor, a therapist can diagnose. A psychologist cannot diagnose. So Carly and I are the only ones on our team that can diagnose mental health disorders. But we cannot prescribe medication. We are aware of medications, and we are aware of if our clients are on medications, but if they want anything, we have to refer them to a psychiatrist to get evaluated. And again, psychiatrists do assessments, they do evaluations, but they say, okay, here's your prescription, go see a counselor.
Yeah.
They're
They're not going to sit with you.
They're not going to sit with you. They'll sit with you to understand what's going on so they can properly prescribe you, but they're not going to do the dirty work, I say, like a counselor does. So you go see them monthly maybe, or every 6 months to get your prescriptions refilled, but you're going to do the heavy day-to-day work with a counselor or a therapist.
Yeah. Oh, that's a good explanation, I think.
So again, it's like when I got into this, like I hope to work with athletes one day. I did the counseling route because I talked to some different networking people, and they were like, just do basic counseling, like see where it takes you, don't limit yourself. The sports psychology field at that time was very small. Back in whatever that was, 2016, 17, when I was looking into school options. So I just did the counseling route. And again, I ended up here. I'm doing this work. I don't necessarily have like the sports courses, but I have the clinical background, and I've taken some certifications to help with the sports pieces, but it's all similar.
And the lived experience. Like I would say, definitely I mean, I always tell Emily, like, I wish I would have had some sports classes options. I think that just would like tie the bow on top of things, but lived experiences, obviously just like so important, so valid. You can understand what athletes are going through, and I think sports are like they don't discriminate. Like doesn't matter what sport you're in, you've probably dealt with all of the topics we talk about and help athletes through. So it's cool to just be like, yeah, I feel you. Like I've felt that before, and I'm going to help you work through this because this is the things I wish I would have known when I was your age or in your shoes. So.
Now I think so that all is like clinical type things. The therapist, counselor, psychologist, psychiatrist, that's all clinical. So you can get your master's in any of that. But on the flip side, for coaching, a lot of our coaches on staff, we all call ourselves coaches. Sometimes I say I'm a counselor or whatever, but they all have masters as well. But those were more in sports science, I think Abby's is kinesiology with a specialization in sports psychology, master's in sports psychology, things of that nature. So they take some counseling type classes from my understanding, to understand like the skill building and rapport building and whatnot, and just understand like mental health disorders to know how to distinguish, because they cannot diagnose and they cannot treat those things, but to have an awareness of them if they have to refer out. But those individuals have master's degrees in more of a sport related science.
And I feel like not the only place, but one of the places that definitely kind of overlaps with the sport and clinical side is your sports psychologist. So like we said before, a psychologist has more of that research, testing kind of background, but as a sports psychologist, you have that research background with sports, right?
Specialized,
So like as a psychologist, you can specialize in a lot of different areas. But I feel like that's like the biggest place where it overlaps to the clinical side.
Correct.
And not to make it more confusing, but our supervisor is a licensed therapist and a psychologist. Yes. So she does have the counseling, mental health, and
Get all of it.
She does all of it. Literally
She's a
checked all the
doctorate.
boxes.
She has everything.
Checked all the boxes. So yes, it's like a la carte. Like how do you, which options
like
do you want to
which-
combine together?
Yeah.
You know, per your passions and whatever that looks like. So.
Yeah, so I think that, I mean, again, with that, like, there is, like, I always say our coaches do the same stuff that Carly and I do with our counseling background. And I know when I first started this business, that was my big question. Like, I thought I had to just hire counselors because, like, when I went through grad school and I had to go through my internship and sit with people in hour-long sessions or 3-hour group sessions, I was like, can any sports psychologist do this? Like, I wasn't sure. I didn't know if that was something people and with that educational background were capable of. Not to say that they couldn't learn it, but I didn't know if their education set them up to have those skills to be doing what we were doing. So I think I've come to learn that, like, it's more of a learned thing that they have those sports psychologists, or like with that more master's level sports psych background, they have all those tools. They may need to learn a little bit about how to sit on a Zoom call and have conversations, but like they can have all of the knowledge and education and tools to apply to whatever those clients are feeling. So I think that's a really cool thing too, of like, you don't need a counseling background to sit with people one-on-one or teams and get through the stuff that they need help with. So I think both backgrounds are very valuable. It's just more about what you find more interest in. And again, like, I knew I didn't want to limit myself to like just that sports psych thing, so that's why I went with more of a basic counseling. But looking back, should I have done that? I don't know. I don't think there's a right or wrong answer.
I think I got the same advice too. Like, just don't close yourself off, because I know you're passionate about this, but that could change. Like, I know a lot of people were like, I never in a million years thought I wanted to be like a marriage or, relationship counselor, and now they are, or couples therapists. And so through the schooling, through the practice, like, you kind of find, oh, that's a cool thing, and you know how to work with that, so I don't know. Either way, it's your passion, your interest, I think, is the bottom line of where you can start, but it doesn't mean you have to end with that, right?
Right. Yeah. The way, like, which is funny, my dad kind of like explained it to me is like, so in general, I want to be able to help people, like, bottom line, right? So that's my arena, is psychology. That's the field where you help people. And then I narrow it down to the section that I want to sit in. Okay, so I got my clinical psychologist degree. And so then I'm trying to narrow down, like, what row am I in? What seat am I sitting in? And so, like, I know the arena that I want to be in, and I know kind of the section that I want to be in. I want to work with athletes to some degree, but, like, either way you go, like, I'm in the arena, the field that I want to be in.
You can
so
move seats,
and I can
or
move
always.
rows.
That's cool. I like, that's a good.
Never thought about that.
Me either.
Good analogy.
Good job, Mr. Bull. I don't know if I've ever said your last name out loud.
That was weird.
Mr. Bull.
Oh man,
That's funny. But I actually like that a lot, because I have had a lot of athletes who are in their junior, sophomore year who are starting to think about careers. And again, I'm not going to go off on a career tangent, but, like, you don't have to have it all figured out.
No.
Like,
No.
find your arena. That's it.
I also majored in education.
Right.
Like
Right.
that was, yeah.
Yeah.
So it's
But-
still possible. It's still
Yeah.
so
If
possible.
your arena is like sciences and that's it, stick with that. Do your prereqs in college if you want to go to college, whatever. Like, go do your community college and get your prereqs out of the way, and then
Right.
figure out what you like. Like,
Yeah.
you don't have to have it all figured out like society makes it out to be when you are graduating high
Yeah,
school.
I mean, if you asked me as a senior in high school, I wanted to be a fashion designer. So yeah, 10 years later, I'm a little
It's a
different
little
field,
different.
but
Yeah, I wanted to be a teacher.
yeah,
Similar, but different.
yeah,
I always say, our boss Ryan, who owns the company, I always say he's lived like 9 lives because he has just his life from where he grew up to where he is now is crazy. But like, he got his degree in environmental science and then turned into a salesman, and then he is now working as a athletic director at a grade school and running a athletic training mental performance business where he has no background and he knows business, so that's what he's good at. His wife does land development, like what, so random. But like, over his course of like 30 years that he's been in a professional, like, look at how much that's changed. I think my dad's similar to that, like where he started versus what he's doing now. It's like in the same arena, but not like where he would have ever expected to be. So I think it's the fun part of life, but also the scary part.
Yeah.
you can always change your mind. You can always,
Yes, please. Don't feel like you
Grow.
have to stick with one thing.
yeah.
By all means.
So
I was going to say something about the mental performance coaching versus
yeah,
I think
we
got
kind of
sidetracked from
got
that.
on a tangent there.
slipped my mind.
So the education piece, I think we kind of went over that, the degree, what it looks like. Also, just to add a little bit of a time frame, like I think so masters are usually like a 2-year program, right? I think all of ours were 2 years.
Yeah.
So that is, just to be very clear, like you go to college for 4, right? And then it's an additional 2 after that. So 6 years of total schooling. Now, if you get a doctorate, that ranges. That can be an additional 3 to 7 years, right? Or plus, like if you are a psychiatrist, med school can be forever. So just to give you also a range, I knew that was an important piece to me of like, I do not know if I can do 6 years of schooling again. Like that is just a lot. And as you get older in your 20s, just what does life have prepared for you, right? So just things to think about. 2 was doable for me. I was like, I can do it. I can do it for 2 years.
I'm not going anywhere for 2 years, so this is fine.
Exactly.
And I honestly thought grad school, not that it was easier, but like, you take up 16 to 18 credits in undergrad, and then you get to grad school and they only let you take 9 or
Yeah.
6.
Yeah.
And I'm like, what are we doing here?
And it was everything I'm passionate about. I was like, I love
Right.
this. Like, this
So
wasn't
fun.
difficult for me to
I
learn.
loved
Like,
the classes. I was like,
Yeah.
was I doing something wrong in undergrad?
Yeah,
But I just
Right.
think
Yeah.
I liked the material better, so it came easier to me, which was
we also weren't playing sports, so that probably adds a layer of, time.
Extra
for us.
time.
Yes.
Yeah.
you were coaching.
I was coaching. That was a full-time job. That's true. That's true.
doing a lot,
I was, but I was, not to downplay it, but it was virtual too, so it made it just
A little different.
a little different during the pandemic. I think they felt bad for everyone, so they were a little easier on us, but no, all good stuff.
Yeah. So I think, again, the biggest takeaways are just understanding for you personally. Like, I know we talked about that way at the beginning. We kind of went on a more educational, professional tangent here, but like, if you feel you're struggling with something, like, figure out, is this just occurring in my sport? Is this occurring just in school? Is this occurring all the time? And make this decision of like, okay, if I feel like I can't manage this on my own, or if it's lasting longer than I think it should, all right, let's reach out to more of this mental health professional in any capacity. And I think another thing is like, it's so hard to find people to reach out to. So definitely like research in your area, just search counseling facilities near me. Look at different reviews from those places, look at the different psychologists or counselors or therapists that are on site, on staff, and see if anybody just resonates with you. We've also said psychologytoday.com is a great resource to just, you search that, search your area, search the type of things you're experiencing, whether it's anxiety, depression. You can say if you want a male or a female. Forget what else they have on there. A bunch of different filters, basically.
Just like things you're experiencing, like their specialties. But I think, not to go on another tangent, but I do think that's a really important piece we missed, is just like the clinical stuff. That is like, with our degrees, we can only work with people in Ohio,
Correct.
right? So
Yes.
if you are in a different state and you do find that your symptoms and your problems are clinical, you got to find someone in your state.
Because there's
Who
different
has a license in your states. Now, mental performance, we work with athletes all over the country.
Coaching can go over state lines.
Yeah.
And again, it doesn't change the things that Carly and I do with our counseling versus our coaching clients. Like obviously if someone who's a little more diagnosed or clinical, we will do specific things.
Yeah.
But it doesn't change the way that we counsel or coach. It's just the licensure piece of we can only work clinically in the state of Ohio within our licensure.
We will never be diagnosing anyone outside of our state lines, you know, and really it is mental performance coaching. Now comes like, how was your day? What else is happening in your life? Like, right? Like you don't always have to talk about just sports,
Right.
even if it is coaching, right? So I think that's a good.
Yes, most definitely. So being able to look at Psychology Today, search in your area if you want more of a clinical piece. I know you can definitely search like mental performance coaching or mental coaching, and different companies will come up. But I think too, even then, like make sure you're looking at backgrounds. Like make sure if it's a coaching business, you know, make sure you feel comfortable and confident with the individuals that have put that company together. I feel like I take pride that all of our people that we've hired have master's degrees, and we make sure that that's a mandatory piece. But just again, make sure that it's a fit for you, and if that's great, that's amazing. But make sure you're looking for just that background to fit and align with the type of work or help that you need.
Yeah. And at the end of the day, just find someone.
Yes.
And hopefully if they're a good provider, they will steer you in the right direction based on, you know, their assessment. Like Emily said at the beginning, mental performance coaches still have the skills to be able to identify what type of provider you need. So it's important that you just start somewhere. If you don't know, get an assessment, ask the questions, tell them what you're experiencing, and they can hopefully point you in the right direction.
For sure. Yeah. I think in this and again, it's a little separate going back to the professional piece of it too, but I think if you are listening to this podcast more of like trying to figure out your career, I think the biggest challenge with the coaching, mental performance coaching world, and anyone coming out of like a master's in sports psych, there are not many jobs that exist.
No.
Yes.
It does not exist. And that's why it's so hard to get like get hours like working with athletes. So I think that's what makes our business really cool. So if you are listening to this as a young professional, feel free to reach out because we get hours. We get hours with clients. We get teamwork. We get individual work. And companies like us, I think, exist. But it's tough to say how credible they are and just like what their growth model or anything that they're doing. And I feel like we've done a good job to just put the right people in place and have the right business model to make it legit and not just some like podunk type of company. Because I just think some of those exist out there and it just scares me. It makes me sad. But I know that's a big piece of if you're looking to do more of the sports psychology field, like the job, there's no direct path. Like a counseling degree, you can go to any agency anywhere and get a job. So I think it's just, again, the sports psychology field is growing, and I think more businesses like ours are going to come about. So hopefully that gets easier as time goes on, but there's no direct path. Which is kind of, I think, why we say, like, find your arena, find your things. Like, you will end up where you need to be if it's not in the timeline that you hope. Just keep waiting and keep holding hope. But
And know that everyone in this field was confused too at one time. So like I said earlier, just talk to people, ask them questions, network, and I promise you they will be more than willing and accepting to help you and just
because they were in your shoes too.
Exactly.
So
Exactly.
But I know the sports psychology field is still like relatively small, and bringing awareness to mental performance, mental health with athletes is still like not super popular. And so if you're looking to like immediately have your education like just pigeonholed there, just understand that it's going to be a little tough like when you get into the job field. But I think that was a big reason for me why I wanted to like broaden my scale with my education and then just work my way into the field. So
I think that's good.
Yeah, I didn't think I'd be doing this for like 10 more years. So
yeah,
it's all about who you know. It's just crazy how time flies, life works, you meet people, and end up where you are.
Yeah. So part 2, how life works.
We will need a few hours to that.
Yeah.
But so hopefully this was. Is there anything else?
No, I feel
I
like
feel like we got the
Touched on
that's
big
everything.
stuff. Yeah.
So I think the big takeaways, and I kind of feel like we've already done this, like if you feel like you're experiencing stuff, like think about, okay, is it just in sport? Is it in my entire life? How severe, how long are these things happening? And then that can help you pick, okay, is it more of a clinical professional? Is it more of a coaching professional? And just know, again, some of these things everyone experiences. I'm not trying to diminish what you're feeling, but everyone has stress, everyone has sadness, everyone has things up and down. Just knowing for you if it's abnormal. Hopefully hearing all the different professions was helpful to kind of distinguish. Again, if you need to just go back and write this stuff down and like make a diagram, go for it.
If you have questions, please reach out to us.
Yes,
But
more than happy to answer. And then if you're a professional looking in the field, hopefully this was helpful too, just to get an understanding of the differences in programs and careers, and just maybe understanding a little more of the gray areas.
Yeah.
But yeah, if you do have any questions, feel free to reach out on our podcast or on any of our social media. Yeah, I think those are the best ways.
yeah, hopefully this was helpful.
Yeah.
So
Hopefully. Like talking about this stuff. I think it's
Yeah.
fun. But
so
Cool. I think that's
cool.
it.
All right.
we will see you guys next time.
Next
See ya.
time.
If you like what you're listening to, be sure to follow the Athlete Cafe on Instagram, TikTok, and YouTube. You can find us wherever you enjoy listening to your podcasts.